Welcome to Encouraging Wellness, where we shed light on the plethora of holistic healing and wellness methods so you can give yourself the power to ask why and become bigger than the condition you are dealing with or the illness you are currently fighting. Join Pamela Worth as she sits down with doctors, medical experts, healthcare practitioners, and those with unique healing stories to dissect groundbreaking practices that combine traditional Western medicine with alternative modalities. Hear conversations that empower you to go beyond hurtful stigmas, outdated practices, and unnecessary labels, guiding you towards a healthier and happier you. Here, we highlight your true worth and help unleash your inner courage. Now your host, Pamela.
Hi, this is Pamela with Hello.Health, and with me today I have Dr. Teri Bagnasco. Teri, thank you so much for coming and being with us.
Oh, so happy to be with you. Thank you for inviting me.
So it sounds like you were born and raised in a medical family in Long Island. Obviously, you have a long 27-year career in emergency medicine, and then you went back and got a second doctorate in naturopathic medicine. It's fantastic that you're bringing both of these worlds together. Tell us a little bit about your experience being not only an MD, but then also an ND.
Absolutely. I realized that my education was incomplete and there had to be more out there, more information, more skill sets to be learned in order to help our patients. I naturally gravitated towards naturopathic medicine, and it came to me very easily, and I was able to incorporate the two together. And I consider myself kind of like the new breed of physician out there. Even though I'm a very seasoned physician, I think the future of medicine is integrative medicine, and bringing these two worlds together is my absolute purpose.
So that's super. So what does integrative really mean? So when someone's listening to this and they're like, so I go to my doctor, what does an integrative doctor really mean?
Great question, because there's a lot of misinformation out there about functional medicine, integrative medicine. People are confused as to what that really means. And my impression of integrative medicine is literally the practice of both conventional allopathic medicine along with naturopathic medicine, working synergistically together in order to help the patient the best way we possibly can. So it's the best of both worlds. There's an indication very often for conventional medicine, and there's also necessity for naturopathy. So integrative medicine is knowing when and how to apply both of those skills, coming at it differently, but working together, not oppositionally, but synergistically together.
So what are some of the things that you learn in integrative health that's different from medical health? Like if I have something, and maybe it would be something that's like a long-term illness or a long-term fatigue, or I would imagine I start to ask these questions if I've got something that's been going on for a long time. What would I look for? What would I find would be different, or questions I should ask, or anything that kind of comes to mind that you want to share?
I think having a discussion with your physician and finding a physician that you're in sync with, that you resonate with, that you trust, you feel comfortable with, to even talk about options of treatment outside of conventional treatments. What do they know? Are they aware? Do they have any education in integrative practices? There are a lot of physicians out there right now, which is wonderful, going towards functional medicine. Another definition I think necessary. Functional medicine is the next step towards integrative medicine, I believe. A lot of functional doctors out there, phenomenal. So they're taking the next step. I think we have room to go even further with functional medicine, but it's a great start in incorporating other practices outside of the conventional box. And one of the things that my take home really greatest point for me was individuality. Naturopathic medicine taught me that no, not everyone is the same. Not everyone presents the same. We don't treat everyone the same. Whereas conventional medicine, as you know, that's kind of what we do. So bringing the two together, and whether it be one physician or a team of physicians practicing integrative and collaboratively, I like that idea even better.
Yeah, that is cool. What's the name of medicine where you're actually looking to get to the root of the problem? Is that functional? Is that integrative? Is it a little bit of both? Or
it's a great buzzword right now, the root cause. And I truly believe that. And that's what we should always be doing. Functional medicine and integrative medicine and naturopathic medicine are all about root cause. Unfortunately, I truly believe conventional medicine is really great at treating after we have a problem, rather than prevention, which is so hard for MDs to do when they have 15 minutes to be with the patient. How much healing can be done in 15 minutes? Not a lot. Whereas naturopathic physicians tend, because they're not dealing with insurance, tend to have more time to really get to the root cause. And that's what we should all be striving for as physicians, not just treating symptomatology. Let's find out why this is happening and let's help the body to heal itself.
yeah, that's a really good point. I mean, I wonder, maybe all of us should be a little bit more open to exploring doctors that don't necessarily take insurance because they're capped at how much time they can spend with a patient before they have to move on, right?
It's so sad that, unfortunately, and every doctor wants to practice great medicine. I think a lot of frustration with allopathic MDs is that they don't have the time that they want to spend to talk about someone's diet, exercise. How's the stress in your life? How's your family? These are things that encompass the patient's total wellness. And we're not even addressing it. We have our little check boxes. Did you have your vaccine? Did you have your latest chest x-ray? And, I think we're missing the boat. And yes, going outside of the conventional box very often is how you get to your healing. And you just have to, and you have to be your own advocate, unfortunately, but it's true.
Yeah. So tell me a little bit about some of the stuff that you learned in natural versus what you learned in regular medical school. I think that's kind of interesting to think about.
It's so interesting. There aren't too many of us who went back to medical school a second time. So I kind of feel like we're on the frontier of bringing these two worlds together. My training at an accredited naturopathic medical school here in Tempe, Arizona, Southwest College, put a little plug in for them, was a wonderful experience for me. Conventional medicine was great, but I knew there was so much more. And if we actually be really honest, what does conventional medicine have to offer a patient? We have prescriptions and we have surgery. Really, there's not a heck of a lot else that we offer patients if you really think about that. Whereas in the naturopathic world, we utilize medicine and surgery when we have to, usually towards the end of our treatment plan, because usually we don't have to go that route. We have more tools in our toolbox, starting with, we have homeopathy, we have physical medicine, we have botanical medicine, mind-body medicine. And these are all just more skill sets that can help the patient. So it broadened my scope and put a lot more tools in my tool belt. So in case the patient is opposed to or wants something, try something else. We have those, and they're based, they're scientifically based. Evidence-based medicine is what's being taught nationally. So, people need to realize that this is not witchcraft. This isn't snake oil salesman. This is an accredited medical school, and it's phenomenal. And I had a great time, and I just think it is the future. And you have to know these things when your patient comes in. If they're taking a botanical herb that you don't know about, you need to know about that. Mm-hmm. So much more comprehensive.
So when you're thinking about a protocol, is there a certain path that you like to follow when you're taking a look at a patient now, or do you have a different perspective on how to?
I literally, it's so many people are so individual and so unique, and you have to find what works best for that patient. Mm-hmm. And it may not be what you're trained in, but if you have someone, someone, that's where you refer them to. Mm-hmm. But the more, and I always go back to, the more tools I have in my tool belt, the better I can help someone. And you have to look for that. And if your physician doesn't offer that, or have a naturopathic physician in their office practicing along with them, then you may need to go outside of the conventional box. But my whole purpose is to bring these two worlds together, and having MDs working together with NDs, with DOs, with chiropractors, all collaboratively. And I think that's the way medicine is supposed to be. I want to use the term very Mayo-like, Mayo Clinic Roundtable, where we all put our brains together and come at the patient at a different approach to better serve them.
Are there any examples of anything like this in the United States at the moment?
I'm not aware of too many collaborative one-stop shopping clinics, and that's what we're planning right now. And I think it's the future. I think this is and I think there are a lot of MDs who want to bring in naturopaths into their practice because their patients are asking for it. And the baby boomers right now, I mean, half of them are hippies, half of them are raised by hippies. They love natural medicine and they're demanding it. And that's what's really steering the bus towards integrative medicine. And if you don't get on that train, you're going to miss it.
Yeah, I think in addition to, it's definitely changing in terms of how to see and be treated. I know that my own doctor, part of Mayo Clinic, I recently got a letter in the mail saying that they were moving away from what's typical and that they're going to a subscription model. I think a lot of folks that I know that are doctors are really struggling in a number of different areas from a cost standpoint. And so they're either having to I'm being told they're being forced to go into a subscription model or join a larger group because they just can't continue to survive on their own. I don't know if you have any experience or any thoughts on any of this.
I do. I have a lot of colleagues who are in that exact position, and I don't envy them. They're in every physician wants to do their best. And I think it's a core frustration that they are unable to, whether it be a time restraint, a financial restraint, a knowledge-based restraint, whatever it may be, finding the right physician, that's the hard part. And that's something that I think we doctors need to do better in our community. And if I can't help you, I know exactly who can help you, who's practicing the kind of medicine that you need. And we have to get rid of the bashing of each other and be more collaborative and helpful. Everyone has something wonderful to bring to the patient. Should not be the animosity that history has. And that's what we need to get rid of and educate both sides to, listen, this is all about the patient. This isn't about us, you, the doctor, and it just serves the patient so much better.
So if I'm a patient or even a doctor that wants to learn a little bit more about the other side and what this all means, do you have any particularly favorite sources of information?
That's funny. There really isn't a lot out there for specifically MDs to search specific NDs, naturopathic doctors. This is something we're working on, an actual website where a physician who wants to incorporate a naturopathic doctor can go and read the bio, the profile of the physician to see if they would fit in with their culture and what the type of medicine they practice, so that we can introduce the other side and say, listen, this doctor can bring so much to your practice to help your patients increase your revenue stream and overall bring you into the new frontier of medicine. So we're working on that. There's nothing I know of yet that exists. I mean, there's a lot of, thank God for the internet, you can look, but you really don't know. And I think having a foot in both worlds is going to allow me to better bring them together. I know most of the MDs here in town. I know all the NDs in town, and we're going to bring them together so they can work together.
Yeah, I know personally for years I've been wanting it's almost like a confidential Facebook group for people to talk, among certain issues and questions that they have. Meets LinkedIn just for functional and integrative health, where you actually could search and, practitioners can put themselves out there with a headshot and a bio and then the contact information. And it's so hard to find what it is you're looking for, and then to find reviews and understand if they're really above board and somebody that you think you could click with. So.
Absolutely. And, listen, I know, there's quacks in every field, in every specialty, and you have to be careful. And I think as a consumer and as a patient, you have to do your due diligence in research and talk to people and interview your doctor and see where their education is. See, if you resonate with them. Are they open to trying new things with you? Are they much more rigid and conventional? And there's thousands of doctors who would love to help these patients. But you got to do some work. Referrals, word of mouth is so wonderful. But I think having a one-stop shop and a universal clinic like that would be what everybody needs, really.
Yeah, I agree. Okay, so over to nutrition. I believe food is medicine. Talk to me about what you have found in your experience that you think is most impactful in health and wellness.
Wow. Obviously, mind, body, spirit, it's all together. And I think if you try to separate them out, each one of them will fail. It has to be done together. Obviously, nutrition, exercise, vital to your health and well-being. I go back to individuality. You have to find what works for you and your body. And that, cookie cutter diet, paleo, okay, it's so confusing for the general public. They don't know what to believe. But that's why when you find a doctor who can introduce you and educate you and find out what works for your body, and then we streamline it and individualize it to you. So your body may not do well with certain macronutrients. It may do better with something else. But this is where you and your doctor experiment together. Those are cornerstones. You can't have health and wellness without talking about that, and not even doing that.
Are there certain tests that you like or prefer over others in terms of finding what might be a good fit for someone nutritionally? I mean, there's some people that are keto, some people swear by high protein, some that are vegan. I mean, it's kind of wild. Some people say blood type. I mean, there's just a lot of stuff out there.
And I think that's why a lot of people are paralyzed by all this information. They don't know what to try or how to do it. And this is where guidance from a mentor, a physician, or someone who's been successful, but that doesn't even mean it's going to work for you. Yeah. I think exposure with your physician, being exposed and trying and being willingness to try and experiment. And you will find it. With the right help, you will find what works for you and your body. And there is no one fit for everyone. That's absolutely ridiculous. We got to get rid of that concept. Ridiculous.
Yeah, fair enough. Anything in particular that comes to mind that you want to share with people? I mean, you've got such an amazing background, emergency room and medical doctor and natural doctor. And
I've been so blessed. I've had a wonderful career. Emergency medicine was wonderful, very exciting. I hope I helped a lot of people along the way. But I think, again, my future is this integration of the two worlds. I want to help doctors find other doctors. I want to help patients find their right doctor. We need to educate the populace. We need to get out there and say, listen, it's got to be the best of both. And you can have it all. You just have to find the right physician. And we need to start back in medical school and introducing integrative courses. And this is another goal of mine. Right now, there's very few medical schools that even have classes on integration. So we're going to try to get that incorporated. Gratitude, big thing for me, gratitude, being grateful. And again, being an emergency physician, I saw death all the time. And it makes you really appreciate every time you wake up and your eyes open to a new day. What a glorious day. It's a new day to try something. It's a new slate, clean slate. And I'm just so grateful that I've had the opportunity to continue my education so that I can continue helping other people. And I think this is where medicine is going. And gratitude and individuality. You can't go wrong with either one of those.
Fantastic. Anything else you want to share with anyone that is listening?
Just, be assertive, be your own advocate, ask questions, don't be afraid. And if you don't like the vibe you're getting from the doctor, he or she is dismissive, they're not listening to you. There's thousands of doctors out there. You got to find the right one. It's kind of like Goldilocks in the right bed. You got to find the right fit, and Cinderella in the shoe. Find the right fit for you. There is a doctor out there who you will join, and they will help you on the journey. You're going to do the work. You're going to have a guide along the way. And that's what you have to do. You have to be your own advocate and help be an advocate for others too, and help other people too with that. Same thing.
Yeah. Is there any where that you would suggest people kind of do an initial search to find somebody that they could find an integrative or functional, whether it's in their community or remotely?
I think functional medicine docs have their own sites, and they're really unified. And I think that's a great place to start. If you want to go straight naturopathic medicine, you can find those doctors listed as well. There aren't too many too many of me out there yet. We're hoping to get a lot more. But this is what we have to do. We have to train and just expand our knowledge and be open and willing, the willingness, and it's easily done. It's the way it was supposed to be. The two worlds were never supposed to be separated, but you'd be in medical school for 12 years, and what crazy people would do that? Maybe like me, but it's just wonderful, and it's out there, and you have to seek it out. It's going to get easier. Right now, it's a little difficult. I acknowledge that it's more word of mouth. Who's your physician? Find someone who demonstrates what you want, who has done what you want to do. Ask them how they do it. Who did they have to help them? So those are great ways of doing it. Someone who's walking, talk the talk and walk the walk. And they're a great resource for you too.
Fantastic.
We're early on the frontier, but we're coming.
It can't come fast enough.
I hear you.
Well, thank you, Dr. Teri Bagnasco. We really appreciate your time today.
Thank you so much for having me on your podcast, and we're to be continued. We're growing, and we're just going to improve the playing ground for sure.
Fantastic. Thank you.
My pleasure. Have a great day.
You too.
That's it for this episode of Encouraging Wellness. We hope this serves as an eye-opener to you on new ways to approach your health and wellness. By learning both unique and the best alternative wellness and healing methods, you can live your best life. Listen to more of our episodes at www.hello.health. Be sure to subscribe to the show and leave a rating. Together, let us work towards unlocking you and your family's best self. Thank you for listening. See you on the next one.